Okay, let me share the screen a second. I'm all discombobulated. Um, okay, good evening, everyone. I hope you are well in this heat.
Oh, today it was good.
Well,
Today
there was a bit
it's
of a
beautiful.
breeze today, like
Mhm.
some wind today, but but you still have to be careful
Oh, yes, it's
in this
summer.
weather. Yeah, yeah. So anyway, this evening we won't hold you long. We're just gonna speak briefly about menopause symptoms and treatment.
Mhm.
So let me go. Everyone can see my screen?
Yes.
Okay, I don't know why it's not doing what I want it to do, but I don't know why it's not doing what it should do. But anyway, we're just gonna go.
Oh, it's not working?
No, it's not giving me the full screen, but that's okay. But you can see it, right?
Is it?
Yes.
Okay. So we're going to talk briefly about menopause, women's menopause actually. And let me just minimize that. Okay. So, all right, what is going on here? Oh, Gisele. Okay. All right. So menopause is a normal change in a woman's life. So, women go through many life cycles. If any of you attended the Foundation Church Women's Forum, I don't know what else to call it, that we had a few months ago. And Loom had produced this booklet, and in the booklet, it went through the different ages of women from their 20s all the way through their 90s, and it described the landmarks that you need to, sort of pay attention to as you hit each decade of life. So one of the decades of life is menopause, and that's anywhere between, well, it can happen a number of ages, but more commonly between your mid 40s and 50s. But like everything else, it's a range of ages. So some people start earlier than 45. Some people, end later than 55. So it's normal, it's natural. And the definition, really the final definition, is when you have not had your cycle, your period in 12 months.
In the bathroom.
Hello. So anyway, it happens because the woman's ovaries stop producing the hormones estrogen and progesterone. So those two hormones are what make us female as opposed to male with testosterone. So it's a natural biological process. It happens because the ovaries stop producing those hormones. Um, and you can get symptoms. Some of the common symptoms noted are hot flashes, emotional symptoms, um, disruption of your sleep, lower energy, different symptoms that people may or may not experience. Everyone is different, and so it's not predictable what symptoms you may have. Like someone may have hot flashes, another person never have any hot flashes. So, but every woman goes through this process and does notice changes, physical changes in their life, and we'll go through some of those. So it's not any medical or surgical problem. It's just natural. So perimenopause is the phase that begins several years before the actual menopause, when your ovaries slowly make less estrogen, and it lasts until menopause, the point at which your ovaries stop releasing eggs. In the last 1 to 2 years of this stage, estrogen levels fall faster. Then menopause, this is when it's been a year since you've had your period, your ovaries have stopped releasing eggs and making most of their estrogen. And post-menopause, these are the years after menopause. Um, so the symptoms that people may get with going through menopause may start to ease, but then, you may encounter other symptoms as well. Let me see what's going on here. Okay. So what causes premature menopause? Medical procedures that people have, like if you have, um, for example, a hysterectomy and they take out the ovaries at the same time, that can cause you to have premature menopause. And then just other, illnesses or processes, premature ovarian failure. You're just for whatever reasons, the ovaries stop releasing eggs. Um, and induce menopause, like I spoke about, when you take out your ovaries for medical reasons such as uterine cancer, endometriosis, or most commonly among Black women is they may have a hysterectomy due to fibroids, and at the same time that the hysterectomy is done, they'll ask you if you want to take out your ovaries because of the risk of ovarian cancer. So, in the years, months, and years leading up to menopause, you may encounter these signs and symptoms: a change in periods, shorter or longer, lighter or heavier, hot flashes, night sweats, trouble sleeping, vaginal dryness, mood swings, trouble focusing, less hair on head, more on face. Signs and symptoms, including changes in menstruation, can vary among women, and some symptoms may require treatment. So, um, sometimes when you speak to your provider and you're going through the process of menopause, they may, depending on what symptoms you have and your tolerance um, to endure whatever symptoms you're having, they may recommend hormone replacement therapy, and that would be to give you some estrogen, that your body is no longer making, so that the symptoms of going through menopause can be sort of alleviated. And so this slide just talks about the varied types of treatments that may be available: topical hormone therapy, estrogen creams or gels, and then because estrogen helps us with our bones, so women become more at risk for osteoporosis. So you can start to take supplements, vitamin D supplements, and especially because we live in the northern hemisphere and our exposure to the sun to help us make our own vitamin D is limited because of where we live. And then also the risk of exposure to the sun um, for skin cancers and things like that. So, some of the things that will help you deal with menopausal symptoms is just what we've talked about, like if you're having the hot flashes, to drink cold water, sleep near a fan, dress in layers. Um, you can exercise regularly to sleep better, to strengthen your pelvic floor muscles, do exercises with Kegel to prevent bladder leaks. And then just stay social. Remember, you're not in this alone. That your seniors have, your elders have gone through it, so you can talk to them about what they experienced and how they went through. So you're not alone, So don't isolate yourself. Remember, we have, a whole community that is full of knowledge that can help us as we go through the varied changes in our life. So don't smoke, limit alcohol, eat a variety of foods, keep a healthy weight, and practice things like yoga, which is more stretching, deep breathing, and massage to help you. So that's the slides about menopause. Sherry, what do you want to do? You want to stop here
Uh,
and
you can
talk a little bit, or
we can stop here and ask if they have questions. Or you know what, we'll take the question after I show the other two videos, and then we'll come
okay,
and show them about the long COVID. So you can just
okay,
view that.
okay,
Let me
all right.
share the videos. Everybody doing good? Okay, hold on. You're seeing on my busy screen. So this is just like a 2 minute, 1 minute video, but it's really
Larissa is 52 and is starting to notice changes with her body. She wonders, is this menopause? What is menopause? Menopause is a normal part of aging for women. Specifically, it is a point in time 12 months after a woman's last period. The years leading up to that point are called the menopausal transition or perimenopause. The menopausal transition typically begins between ages 45 and 55 and lasts about 7 years, but can be as long as 14 years. How long it lasts can be influenced by lifestyle factors such as smoking, the age the menopausal transition begins, and race and ethnicity. During the menopausal transition, estrogen and progesterone levels, two hormones made by the ovaries, vary greatly. Women may experience unpredictable hot flashes, sleep problems, changes in monthly cycles, and other symptoms. A woman has reached menopause when she hasn't had a period for a full year, after which she enters postmenopause. Not everyone's experience is the same, but remember, menopause is a normal part of aging and not a disease that must be treated. If you have questions about the menopausal transition, talk with a doctor. Learn more at www.nia.nih.gov/menopause.
okay. I'll put that in the chat in a bit. So let me share the other screen. Hold on. Okay. This is a little bit longer. This one is about 5 minutes. Okay.
Confusion surrounding menopause. So I'm going to take the next few minutes to tell you exactly what's happening in our bodies when we go through it. You can almost think of menopause as puberty in reverse. Hey, it's your favorite OBGYN, and I'm here today to talk about a subject that I find truly fascinating, menopause. Chances are you probably don't find it quite as gripping as I do, but I promise that if you can get past the horror stories, you'll be riveted too. Whether you're going through it or know someone who is, you'll recognize there's nothing to fear. So what exactly is menopause? Technically, menopause is diagnosed 1 year after the final period. But most people use it to refer to the entire span of time when our menstrual cycle is changing in length, a process that lasts several years and then all the time afterwards. So it's best to think of menopause as a continuum, starting years before during what is called the menopause transition. Just like puberty, the process happens over many years. The menopause transition is one bookend of our reproductive cycle, opposite puberty. When we're born, we actually have all the eggs we're ever going to make, about 1 to 2 million of them, unmatured and encased in follicles in the ovaries. Around the age of 8 to 10, the hypothalamus, a region in your brain, starts releasing a hormone that essentially wakes up those dormant eggs, beginning the monthly cycles of ovulation. This is what increases production of a class of hormones you probably heard about, estrogen. Estrogen, along with other hormones, begins a delicate hormonal dance that once a month results in the most mature egg leaving its follicle and traveling down a fallopian tube. The body builds up the lining in the uterus, the endometrium, to house the egg. And if the egg isn't fertilized, the lining sheds and we have our period. This cycle repeats over and over and over for decades. On average, sometime in the mid-40s, ovulation starts to get erratic. We just don't have as many eggs, and the ones that remain may not be as healthy anymore. Estrogen can be lower some cycles, and even higher during others. This is the menopause transition, hormonal chaos like puberty. Only this time, when estrogen levels stabilize, they'll be much lower than they were before. This very normal decrease in estrogen and other hormonal changes does come with medical concerns, such as osteoporosis, heart disease, diabetes, and vaginal dryness. Some of us are lucky and we will have no or mild symptoms. Others will experience trouble sleeping, irritability, depression, or decreased sex drive. And then there's the most classic symptom, hot flushes. They're a wave of heat that makes it feel like the furnace just got cranked up on the inside. Scientists aren't completely sure why this happens, but the resulting heat makes you feel sweaty and off kilter. Some women even have symptoms that overlap with anxiety, like nausea and palpitations. But for me, it feels as if I've had too much to drink. Those are some of the negatives, but there are positives too. After menopause, you don't have to worry about periods or cramps, and people who partner with men who make sperm don't have to be concerned about unintended pregnancy. You're through all that. To me, menopause is something we go through, like puberty. And like puberty, there's a range of experiences. We continue to make vital contributions to society after menopause. It's not your dotage. Your worth has nothing to do with your ovaries. So let's say you're in the menopause transition. What are the best things you can do? If you're suffering, there's almost always some kind of help. If you smoke, definitely try to quit. Not only will it reduce your risk of heart disease, it might also reduce some symptoms of menopause. Reducing stress and getting enough sleep is also good. Focus on eating a healthy, balanced diet rich in calcium and vitamin D for healthy bones. And try to get at least 150 minutes of moderate physical activity a week, especially if it's weight-bearing exercises, like hiking, dancing, or jogging. If you're losing sleep or having hot flushes or experiencing other symptoms that affect your quality of life, talk to your doctor. Don't rely on wearable magnets or so-called compounded hormones. These are unproven and have risks. There are a variety of proven options, from cognitive behavioral therapy to FDA-approved estrogen and some non-hormonal medications that can be very helpful. There are so many permutations and combinations of options that safe therapy can be customized for almost every woman. One more idea, have a mantra ready. When I get a hot flush, sometimes I tell myself, I'm feeling this because women have evolved to drive humanity forward. This is a sign of my strength. And then I can make it until it goes away.
I love it. I love that part. This is a sign of my strength. I can make it until it goes away. Wow, amazing. Great, excellent. So I don't know if you have any questions, any comments. Mimi?
Yes, hi, I do have a question. So for people who have fibroids and they typically keep their fibroids, when they go through menopause, does the symptoms disappear? Does the fibroids shrink? Like, what is the research on that?
I'm not sure. I'm gonna ask if Dr. Coney knows the answer. If not, I can do some research and get back to you.
Okay.
Yeah, there's a lot of variation on that. You know, depends on the size of the fibroids, the location of the fibroids. You know, so that's something that really has to be discussed with the OBGYN, with the gynecologist, because you know, there's just a lot of variants to consider, variations. Like some people may have smaller fibroids, you know, that may shrink, but then others may have larger fibroids that even though they go through menopause, the size of them, you know, becomes a concern for the gynecologist. So it really is individualized. And the gynecologist, you know, they will make a recommendation to the individual whether or not they think they can go through menopause and the fibroids will shrink, or if they deem that um, it's, you know, better to remove the uterus.
Thank you so much for that. And I just have one more question.
Mhm.
Are there any premenopausal symptoms that one can experience and see, okay, maybe I am gonna go through menopause soon?
Um, you can look at your family history. You can ask your, you know, your mother, ask your aunties, other close, genetically close relatives, female relatives in your family when they went through menopause, or what the symptoms that they had when they initiated or first started noticing symptoms. And that's probably a good guide as to when you will go through menopause.
Yeah,
Okay.
I think like what we shared earlier, the menopause is at a point after a year that you haven't had your period. So the perimenopausal period or the transition period is a time before. Those are when you start having all those symptoms that we shared. And I know, like Dr. Coney said, specifically to your family, every family sort of have some kind of symptom that is common because of genetics, you know, but we had shared like the overall kind of possible symptoms that could happen. And then we have the postmenopausal period that you have after the menopause has finished. What are the things that you have? What are the things you experience? But those are basically due to the hormonal level that is so low that will affect those symptoms that you experience. So yeah, absolutely. Ms. Sabrina?
Thank you.
Good
Thank you so much.
evening. Okay, good evening, everyone. My question is, I truly believe I went through menopause when I was pregnant because I didn't get no menopause every since the signs of it. And I'm 61. So when I was 36 with my last child, I went through this heat wave like never before, and I had other children, and I never went through that. So I wanted to know, is that true, or I never experienced it? If that's the case, I don't know.
Dr. Quinn, before you answer, let me ask a clarifying question. Are you saying that you think you went through menopause while you were pregnant, or you think you got pregnant going through menopause?
Right, the last one, because usually it's like you have to, like she explained it, like you get the 3 days and it stopped and it come to and all of that. I went through all of that, but what I'm saying is that I never experienced menopause, if that's the case. I didn't go through that. I don't know what it's like, but I'm just saying, that was my last child. That was the time when I was going back and forth with my cycle. Like some days I had, I might get it, in 2 months I won't. So I was going back and forth a lot with my menstrual. But then after I had him, then it just stopped like right away. But I never experienced the symptoms of menopause like women's would naturally get it after their cycle is over, or they going through the back and forth.
I mean, what you just said now is just like an explanation of the symptoms, like your period was irregular. It was not coming all the time. That's the beginning part of it, before it actually stopped for an entire year. So that's the beginning part. That's actually some of the things I am experiencing right now. Like my period I didn't have it for like almost like 11 months. Then it came back.
Yep.
Days,
Yep.
then
I went through that too.
6 months. So the point is, even though we're going through the process, the ovaries there's still some eggs at the ovaries. So when you have your period is when there's ovulation, and then you go through the cycle, then you have your period. So there's still sometimes some semi-viable egg, and when you have ovulation, then that means you're going to have egg that release from the violent period too. So that's what is happening sometimes when that happens, or you get that old 1 year without your period, then it's scientifically confirmed that now you are at menopause. Dr. Cooney, you want to add to that?
Well, before you say anything, I felt like mine had stopped at 37, and then it came right back on. Like after the year, it jumped back on again, and then it didn't lead to 57.
Well, each one is different and experiences things differently. So it sounds like you were perimenopausal, and just had the ups and downs of release of estrogen, of the hormones. But it sounds as though you were perimenopausal, and then finally went through, after you didn't have your period for a year, then that was the menopause.
So then you don't have to really go through, like some women, like my girlfriend, I felt so bad for. I was trying to get her on the phone, but it was her birthday yesterday. But she has it so bad where she had to cut her hair because she used to just pour out sweat. Then it got to a point she has to release her clothes. And then I had another girlfriend said it felt like fire up under her feet. And she was like, you don't want this. Oh Lord, you don't want this. So I just thank God I didn't experience it that way, like those type of signs and stuff. Because everybody asked me, you didn't never experience it? I said the only thing I experienced was the 1 or 2 times it popped back up on, then it'll go to 11 months, then it'll pop back. I didn't go through no hot flashes, no cold flashes. I didn't have no mood swings. I just didn't understand like what is going on. Do every woman have to go through that, the same symptoms? Which I said no, because I didn't go through what my girlfriends went through.
Yeah, you got it. Like Dr. Cody said, you don't have to go through the same symptoms. Everybody is different. I think at this point, I would like to mention before we take other questions is, it's really like a big deal with menopause, and for women that are married or that are sexually active, to have conversation with their spouses or their partner and let them understand, this is what I'm going through, this is what my body is feeling, so that there's that mutual understanding when there's maybe decreased sex drive or any other thing that is going on. So there's understanding, and also when you're having irregular periods, you may still be able to ovulate and release an egg that is viable. So there's still that possibility of pregnancy even during the premenopausal period. So it's important for you, if you're not planning to get pregnant, to use protection if you're sexually active. So I just want to plug that in. Any other questions, comments, or anyone that want to share their experiences?
I have one more question. So I don't know if it's a myth or if it's a fact. I know they said that when you start puberty, when you start your menstrual cycle at an early age, like some girls experience it at 9 years old. Is it true or fact that they will experience menopause at an early age versus those that have their menstrual cycle later on in life, like maybe 17, 16 years old? Is that true?
I don't have any response to that specifically.
You have to look at your family. You have to look at your mother, your close female relatives.
Okay. So you just have to, it basically goes by like genetics then.
Yeah, more or less, that can give you a better gauge on what happens within your family.
I see. Okay,
Yeah.
thank you.
I'll read to you something that I just found out. I just Googled it. It said there's no consistent evidence that the age at which someone starts puberty is associated with the age at which they go through menopause. However, some studies found that women who start menstruating at a younger age have an increased risk of early menopause. For example, one study found that women who start menstruating before the age of 12 were 31% most likely to have early menopause, while women who start menstruating at the age of 13 had a much lower risk. And another study found that women who menstruate at the age of 11 or younger had an even higher risk than those risks was even higher if they didn't have children. So yeah, and then of course with genetics that was mentioned.
Thank you for that information.
Absolutely. Oh, go ahead, let's see.
Yes, good evening, everyone. Dr. Coney, I have a question. I heard when you said start taking the supplements like the vitamin D and things. Are there any other things like I read primrose oil, is that good? Or just stick with the vitamin?
I'm sorry. The phone is just going off. Give me a second.
Okay.
Okay, while Dr. Coney is getting that together, let me just talk about it. It was mentioned osteoporosis is one of the risks when you're going through menopause because, of course, the hormones affect our bone density and things like that. So I want to encourage you, when you go to see your gynecologist, just tell them, can I have a bone density test? When is the right time for me to have a bone density test? I actually had one recently. Yes. So you want to make sure you get one in if you're like at least 50 years old. Some doctors are more proactive than others. So at least you have a baseline and they will know if you really need some things. And also when they do your blood work, let them check for your vitamin D level to make sure if you need it. Okay.
Thank you. Mm-hmm.
Yeah, that's what I was gonna say. Have them check your vitamin D levels. I don't know about primrose oil or anything like that, but you can have your vitamin D levels checked easily, and then they can supplement recommend supplements if your levels are low.
Okay. Thank you so much. I appreciate that.
Sure. Any questions? Any other question, comments? We can always learn from each other. Go ahead, Sister Rosie. Go ahead.
No, I'm just wondering now. I mean, this is a compliment because I'm 80 years old. I passed the stage of menopause, man. But anyhow, besides that, I'm just wondering because I have osteopenia, and I remember way back. And I remember, like I'm 80 years old, so it was way back. They wanted to give me hormone replacement therapy. I think because I used to have some symptoms, whatever it was, but I refused it because at that time I heard that it was questionable. So maybe that's why I have osteopenia. Could that have done it? You hear what I said?
We
No.
did. I don't have an opinion. I could read some things out to you, but I'd like to talk for the answer first.
I don't know.
No, I can't comment on that either.
I could just read a little bit about bone loss, a condition that, that's leukemia. For those that doesn't know, that's bone loss, a condition that occurs when the body doesn't make new bone as quickly as it reabsorbs old bone. Causes include low calcium diet, smoking, age-related hormone changes, which of course could be related to menopause or premenopause, and certain diseases and medication. Women are most at risk. Okay. You're welcome. Okay. This has been great discussion, right? This has really been good, been helpful. And I'm glad we recorded it. I'm gonna convert it to YouTube and share with everyone. And feel free to share with people in your family, your friends, or people that may need it. You know, for those that came late, then you can review what we spoke about in the beginning. And if you don't have any more questions, we're gonna go back to the slide and sort of give you a little overview of what is going on with COVID-19 and how we can continue to be aware. Dr. Quinn, you want to share and talk about the last two slides? Or if you want to just freestyle, whichever way you want to do it.
I'm sorry, I'm trying to get myself together here.
Okay, well, as she's
Yeah,
working
yeah.
on that, just know that people are still getting COVID-19 virus. So just be mindful of that when you're going to like large gatherings, even as we continue to gather together and have summer funds, we want to be safe and protect ourselves, you know. So let's be mindful of that. Okay, go ahead, Dr.
Yeah, that would be my my comment is that COVID is still around. It hasn't disappeared. Just make sure that you are up to date on your vaccinations. And if you are 65 and older, even though you got the booster last fall, you might want to consider getting another booster because the effect of the vaccine does wane over time. And also just to know that there's no shame in wearing a mask. Okay, there's no shame in keeping your hands washed, hand sanitizer and throwing on a mask if you're in a crowded situation or some place that you just don't feel comfortable. So there's no shame in that. So you know, just be bold. Be bold in practicing what you know in terms of protection for COVID.
Yeah, I do appreciate that. Be bold in practicing what you know, because there are different kind of theories out there of what, but one thing we know for sure, people are still getting sick from COVID-19. So that is a fact, you know. So we need to continue to protect ourselves. So just a little in the form of announcement on Thursday at the Loom office for those of you that are close by the Far Rockaway area or you're in Queens, you can join us to do a blood pressure screening, hypertension workshop, and we're gonna give out what do you call it, blood pressure machine for those whose blood pressure are high when they come to visit. So yep, so that is one form of announcement. And I see Sabrina's and is still up, or is from before?
Oh yes, no, it's up. Quick question. I know I briefly asked you, but would you think if these cases is going up high, will they think to give the COVID test? Because we have a lot of people are asking because they have COVID.
Yeah, that's something that we, Dr. Cooney is trying to navigate with the Department of Health. You know, I know when we meet, she meets with them every weekend. We're trying to get that on the roll, but there's been a glitch, but yeah, it's gonna happen soon. And you know, as soon as we have it, we're gonna share it. So yeah,
Amen.
Bemi?
Yes, hi. So for long COVID, I know that there's been a lot of like research being done with the symptoms that people are having after having COVID. My question is, does long COVID happen either you're vaccinated or non-vaccinated? Like, will you still experience long COVID either or?
It's more likely to happen in people who are unvaccinated than people who are vaccinated. That's what the data shows right now.
Okay,
Yeah, so
that's clear.
it's better to be vaccinated than unvaccinated.
Okay, does the research shows that people who've been vaccinated and contract COVID, do they have long COVID?
The research shows more long COVID. You know, nothing is absolute. But the research shows that people who are unvaccinated are at higher risk for developing long COVID than people who have been vaccinated. So that's you know, that's what it shows. There's nothing absolute. It's not to say that someone who was vaccinated and then got COVID can't get long COVID. It's just very unlikely.
Okay, thank you.
Yeah, okay.
Okay, so I think, I don't know if there's any more people that have any comments. Thank you, Dr. Sunday, for joining us. It's nice to be in the room and have a male presence supporting this topic. You know, thank you very, very much. Sister Myrtle, you're quiet today. You have any closing remark? Welcome, Sister Sheila from North Carolina. Thank you for joining us. Okay, Sister
Well,
Nicole.
thank you, everyone. Yeah.
Us.
And the questions,
Thank
keep
you,
the
thank you.
questions coming. You know, think about when we post the topic, think about any questions that you might have regarding those topics. It's important, you know, that we ask questions and that we together find out the answers that we need to go on. So
Yeah.
I appreciate all the questions that we get.
Yeah, I echo Dr. Coney. The questions are fabulous, you know, learned a lot from the questions. So yeah, so thank you very much. I don't know if you guys have any passionate topic you would like for us to tackle in the next 2 weeks, which will be, I think, second week in July. Oh, I can't believe it. Oh my goodness, July. So if you have any particular topic, so let us know. And if you can't think of one now, you can always text myself or Dr. Crony, and then we'll work on it and have information ready for you. You make us learn more. Like, I love research, so yeah, it's always interesting to.
Can I say something?
Go ahead.
I just since the older adults, that's what they call them, the senior center. I can't stand the word older adult. It used to be senior, but anyhow, and in our church, wouldn't it be nice for something to be spoken about, like memory issues with remembering things, you know, memory issues.
Oh, memory. That's
right.
interesting.
Because then we could tell, because now we have the senior citizens of the church are getting united now with having a program every so often. But I think that would be a very good one for the seniors. That's just, you know.
Okay.
And, okay.
We'll think about it. We'll dialogue about it. That's a good topic. Okay, great. Excellent. Memory issues. Dr. Quinn, what do you think about that?
Yeah, it's a good topic, and there's some things that people can do to, maintain a sharp mind. Keep your mind in focus, all of us, not just seniors. All of us can do things to sharpen our mind and our memories. It's an active part of our life. And it doesn't matter what age you are, you can still work on that aspect of your health.
Okay, retaining sweet memories. Great. That could be a nice topic for it. So, Dr. Sunday, do you want to say any closing remarks before we close the platform? Okay.
I really don't have. It's a topic that I'm actually learning from, so I have nothing to contribute to it.
I'll give you
And if you, whenever you're going to treat the memory stuff, I think I will benefit a lot from it. Thank you.
Okay, have a good night, everyone.
Okay, thanks everybody.
Good
right,
day.
good night.
Have a
Good
good night.
information.
Yeah.
Good night, everyone.